everyone, I'm Dr.Garima Asati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic anal fissures in English on the demand of few of my non-Hindi patients. So let's talk about these anal fissures. It's also known as rectal fissures or fissure in anal. At first, I would like to tell you what actually fissures are. So if there is a break or tear in the skin, it is termed as fissure. But when these breaking or tearing occur in the region of anal canal, it is termed as anal fissures. Friends, before that, if you have not subscribed my channel, tell you kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you some of the homeopathic medicines which can be helpful in curing these anal fissures. Now these anal fissures are very common. It occurs 1 in 350 persons. It is more common in males and females in the age of 15 to 40 years. Now friends, I would like to tell you about the symptoms of these anal fissures. In acute conditions, it is very painful, while in chronic conditions, it can be painless too. Now, it causes bright red bleeding, especially on the toilet paper or undergarments, or can be seen even in the toilets. It can be superficial or very deep inside too. Now, let's talk about the complications of these anal fissures. So, skin ticks may produce, which can cause discomfort and pain, and it can also lead to abscess around anus. Now friends, I would like to tell you about the causes of these anal fissures. So the first cause is overstretching of the mucous membrane of the anal canal, which can cause this fissure. Over constipation and excessive diarrhea can also lead to these fissures. Some bacterial infections may also embed along with it. Decreased blood flow can also lead to these anal fissures. Some diseases like TB, AIDS, leukemia, anemia, or some STDs like HIV and papilloma virus, etc. These also can lead to this anal fissures. Childbirth, during pregnancy, it can also cause these fissures. Anal sex, Crohn's disease, ulcerative colitis, and poor toilet hygiene can also lead to these anal fissures. Now let's talk about the prevention of these anal fissures. So the first and the foremost one is we should have to maintain hygiene. So hygiene can even decrease the risk factors for these anal fissures. Then fiber-rich diet is essential. Increased intake of water should be there, because it can cause proper blood flow to the area, and one should have to avoid straining to the defecation. So avoid constipation. So drink excess of water to get prevention from these anal fissures. Now let's talk about the treatment of these anal fissures. So the acute or the superficial variety gets cured by self, while the chronic or the deep variety requires treatment for it. So allopathically, it is only surgical. Now let's talk about the homeopathic cause. One of the cured case of this anal fissure via homeopathy, and some of the homeopathic medicines which can be helpful in curing these anal fissures. Now the homeopathic cause is indigestible anger, and patient wants to get rid out of the unpleasant or rubbish thing, but unable to get rid out of it, and becomes destructive in the mind. Now let's talk about the cured case of these anal fissures via homeopathy. A patient aged 42 years suffering from these anal fissures since last 5 days. Having too much burning after these stools, and that was too severe burning. There was pain, itching sensation and bleeding too. His generals was he was craving for eggs, and The mental general was there was ailment from business loss. He was in affair with a lady who confiscated his money, and he was unable to express his anger. His need was support, too timid constitution, horrible things affect him profoundly, and the rubric taken was ailment from business loss. The medicine given was Calcarea Carb 200, which cured him completely within a period of 1 week. Now let's talk about some of the homeopathic medicines which can be helpful in curing these anal fissures. So the first medicine is Retania. So the fissures are too painful. A splinter-like pain is there. There is too much burning and burns like fire. When we see the mental generals, the patient is very much irritable, quarrelsome, always fearful that something will happen, desires to die in pain and desires for company. So if these symptoms correspond, Retania will be helpful in curing these anal fissures. The next medicine is graphitis, so fissures which always oozes or which gets easily ulcerate. There may be burning and cutting along with these fissures. Having a history of prolonged diarrhea which causes great prostration. The mental symptoms of this graphitis is disinclination to work. Indolence was there, great anxiety, morning anxiety seen, and anxious for health. So if these symptoms correspond, graphitis would be helpful in curing these anal fissures. That's all about this topic. We'll meet soon with a new topic, new subject. Friends, it's my humble request to you all, kindly don't take any medicine without consulting doctor. The clinic address of mine and the contact number is given in the description link. And kindly don't forget to subscribe my channel and tap the bell icon to get the latest updates of the videos. Stay connected to stay healthy. Thank you.